Good morning.
Thank you. Good morning.
Thank you for taking time from your busy schedule and joining us here. My name is Sevak Sohrabian. I'm the CEO of Glendale Association, and we have our board members, our government affairs director, and other interested members who are on this call for these interviews. Um, First, I will give you a brief overview of our association, and then we'll follow with some ground rules. Then you'll have a chance to give us an opening statement for about 2 minutes long. And after that, we'll start with the first question from our president. So, for you to know about the Glendale Association of Realtors, we were established back in 1920, 106 years history in the city, probably one of the oldest organized groups of professionals in the city. And from very beginning, our members have not just been members of association, but very much a participant in our community. They've helped shape the community. They've participated in the city council, chamber of commerce, planning commissions, school boards, and many civic bodies that are operating in the city of Glendale. Uh, and I must say, with distinction for their leadership and service. Giving back to our community is not an afterthought for us throughout this 106 years. It is part of our DNA. And year after year, Glendale Association has supported local organization community initiatives. More specifically, over the past several decades, we have raised and distributed more than $1 million to causes such as the Salvation Army and other vital community partners that do operate within the city of Glendale for the benefit of city of Glendale residents. So today our membership exceeds about 1,500. I would round it up. We approximately 1,200 of us being registered voters in the city. You factor in our families, our clients, and extended networks, sphere of influence. You see that this conversation, therefore, does matter with our candidates. Now, as far as the ground rules, as I mentioned, you will be allowed a 2 minute opening statement. After that, we'll have our first question with our president, Drew Garbeti. I'm going to ask you that. And we go after that time aligned. Hopefully, we'll get close to 6 questions from you today. At the end, you will have a 2 minute closing statement opportunity. And with that, we will finalize our interview at that time. All right?
Sounds good.
Okay. With that said, you are at bat. Dodgers have started. Sorry, I could not resist. Please give us your 2 minutes opening statement. Thank you.
Sure. Well, thank you everyone for your time. My name is Dr. Carolyn Kaloostian. I'm a physician in family medicine at Keck Medicine of USC. I'm also a professor of medicine, so I teach the medical students who are becoming physicians. I'm also a public health leader. I say that because I've worked with the Department of Public Health for LA County and helping, not just your patient in front of you, but really the community at large. And I would say, other than that, it's important to know that I come from a family of service. You had mentioned that in your DNA, it is to serve. I couldn't, relate more coming from the family I come from. I'm a fourth generation Californian, and definitely feel like service is sort of part of who I am. Other than that, I would say I want to bring sort of the viewpoint of a compassionate physician to City Hall, where, we basically don't just treat symptoms. We sort of look for the root causes and we treat the issue at hand, and not just symptoms. Also, I would say that the experience that I have that makes me feel like I would do a good job in this role is many. I would say that I'm, other than my small clinical practice that I have, I'm sort of in the administration at USC. So I'm the chair of the Quality and Standards Committee at Keck Medicine. And what that means is when there are issues at USC, sort of comes to me, we build strong teams, put a system in place to fix those problems and so they don't happen again. Other than that, I'm the chair of the American Heart Association Heart Walk this past year, raised funds, brought organizations together, and we were able to have a very successful heart walk. And lastly, we got sort of the Grammy Award for the work we did with public health and the American Red Cross, and trained over 250,000 LA County residents in bystander CPR to save lives. I know with under other candidates and some of the things they've done, I think it's important to realize that I have been very involved on the county level, and it's about time that we work locally after seeing some of the changes. I want to make sure that I'm involved and that I can help out. Most importantly, I'm a Glendale mom. My kids will be teenagers in the next 4 years. I want to make sure that we keep our communities very safe, very walkable, and healthy, not just physically, but also our small businesses. And so I would say that's a good minute and a half for
All right.
everybody, I hope.
Thank you so much. We appreciate that. Let's start with our first question from our president, Drew Garpetian. Drew?
Good morning, Doctor. Thank you for joining us today. My question to you is in regards to revenue measures. To address Glendale's projected structural budget deficit, some have proposed placing various revenue measures before voters. Would you support placing any of the following measures on the ballot? And if so, please explain. Number one would be parcel tax. Number two would be real estate transfer tax. Number three would be a sales tax increase. And number four is a vacancy tax on residential or commercial properties. Thank you.
Yeah, great question. And I'm against, one of my pledges is against all tax. I would not do any tax. Our issue with the city budget is not that we don't have enough funds. There's clearly enough funds. We went from 800 million budget to 1.2 billion dollars, like some small nations. And so what needs to happen is we need to, with a fine tooth comb, kind of take a look, see what we could do more efficiently. This happens in medicine all the time, not uncommonly worked on in the quality committee at Keck. And so usually forensics accounting can really look at this, and that's going to be a lot cheaper than how we're spending $500 million a year, just like the LA River just shoots out our water so we don't flood. This is what's happening with our budget. So no, none of those taxes will be proposed by me. But contrary to that, we will look at where we can do better with our funds. And then I have a couple of options for revenue to come in, which is capitalizing on resources we already have. But as I alluded to, we just shoot them out and we're not capturing and utilizing things that are given to us. And I think we need to do that.
Wonderful. Thank you so much. We will go to our next questionnaire, who is our local government relations chair, Eddie Minassian, past president. Please, Eddie.
Good morning, Doctor. How are you?
Doing well, thanks.
All right. Question for you is the the district elections. Do you support or oppose transitioning Glendale from at-large election to district-based council elections, and why? If you support districts, how many should Glendale have, and what criteria should guide the map? If you oppose districts, how would you address the city's CVRA exposure and potential litigation cost? Thank you.
Yeah, so great question. And so if this was like, oh, sorry, can you hear me okay?
Yeah.
Okay, good. If this was years ago, I would say we need to ask the public, but we've asked the public several times, right? This has been voted on several times, that the public agrees that we want to keep them at large as is. So I don't want to change to districts. And we can talk a little bit why. I have some notes here, but these are some of the reasons. We really don't want to fragment representation into the districts. It also allows residents to reach out to multiple council members, not just the one person that's representing you. I think that's important. And also the district systems can sometimes amplify income disparities between neighborhoods, and then you start seeing resources not the healthiest of ways going to one area and not the other. So we really want to keep our mission, vision, and goals for the whole city. And so that's what I would recommend. And then actually I brought up the CVRA exposure to the city attorney. I was part of the leadership academy over at City Hall these past 7 weeks, just graduated. So I got to talk to every single department face to face by name, ask them, vet all my suggestions, and just so happy to hear that we're all on the same page and really have some really great viable options. But in regards to the CVRA, when I spoke to the attorney, he said, that's a great point. Other cities have had issues with that. We haven't yet. And I said, do we have, in the kindest of ways, do we have a proactive, right? Because we know we're at risk since we're not districted. Do we have a proactive strategy to prevent litigation? And, I was a little discouraged, but hopeful. There is no proactive work to prevent litigation. And in this financial situation we're in, I'm a family doctor. It's all about prevention, right? Avoid crisis, and a litigation of this level in our community would be tragic. So he and I at the end of the meeting spoke, and we discussed how important it would be. And he said, yes, we'll bring that up. And he agreed there are enough attorneys that are working for them that we can put a preventative strategy in place. So this isn't something that that happens to us. Yeah, hope that answers your question.
Great, thank you.
Thank you so much. We go to the next question, and that's coming from our board member, Armik Avedissian. Armik? You're muted, Armik.
Yeah.
Okay.
Good morning. Good morning, Doctor. Welcome.
Thank you. Good morning.
Let's see. Question I have, in general, which type of housing development do you believe in Glendale should prioritize? Large apartment buildings, mid-scale multifamily, approximately 8 to 16 units, ownership housing such as single-family homes, condos, and apartments, and or balanced mixed developments on any location.
I love this question. Thank you. So I would say, as a suburban-oriented mid-sized city, Glendale should prioritize human scale and community-focused housing that balances density with livability. So ultimately, my favorite, and again, we'll definitely lean on specialists and experts, but I feel the more sustainable model is mid-scale courtyard-oriented urbanism, including row houses, townhomes, and smaller multifamily developments organized around a shared outdoor public and private interior courtyard. Studies show that this sort of housing, such as courtyard apartments and row houses, can achieve density of about 20 to 40 units per acre while maintaining the character of the neighborhood. So these are my favorite. I live in historic Rosmoyne, and when I drive around, I see just how it's great in regards to volume and about outdoor livability and really integration for the community. So that's very important. And then again, being the sort of data-driven candidate here, there's a lot of data that show that this would improve not only the livability, but also improve mental health outcomes. And we also see 30 to 50% crime reductions with this sort of design. So that would be my recommendation. Otherwise, efficient land use can be achieved this way, and inappropriate commercial corridors. I would support mixed use buildings with neighborhoods serving retail on the ground floor, markets, pharmacies, essential services. And these can further reduce short car trips and congestion and parking, support walkable communities. And those, again, the data is 20 to 40% fewer car trips than those in single use areas having this mixed use approach. And I think that that sort of covers my preferences. Yeah.
Thank you very much. Very detailed. Thank you.
Thank you, Doctor. I appreciate that. We're going to go to our next member asking your question, one of our past presidents, Rick Boniati.
Thank you, Dr. Kaloostian, for joining us today. My question today is about bike lanes. And do you support or oppose removing vehicle lanes to create bike lanes only? And if you support lane reduction, what evidence do you have that voters agree? If you oppose lane reductions, what alternative mobility improvement do you propose?
Thank you so much. Yeah. So, I mean, I can't say it any louder how much I don't support bike only lanes, or any lane removal. Just trying to find my notes here. It's always important that we do research before we answer these questions. But essentially, from being the safety first candidate, I do not recommend any fragmented bike lanes, especially that are not protected, meaning a barrier between the human on the bike and buses and cars, right? I hope some of you saw some of the recent Los Angeles news about road rage and, cars that could easily get into these bike lanes. So I would never recommend fragmented, which are almost all the bike lanes you'll see on streets. Fragmented means between the crosses, it stops the bike lane, which means ambulances can come, or buses and cars that run red lights, right? Very dangerous. So for my children, for the residents, for my patients in Glendale, I would want a continuous bike lane that's protected and not on busy streets where there are large vehicles and buses. And then lastly, let's see. Just some facts, right? We want to always be data driven. Studies show that protected bike lanes, meaning there is a physical barrier between cyclists and vehicles, reduces cyclist injury by over 50% compared to those without it. And also, cities that implement connected off-street bike lane paths, significantly higher usage is seen, with an increased ridership of 50 to 75%. And that's from the U.S. Department of Transportation. And yeah, I think if Glendale is very serious about cyclist safety, I'm not saying what is safer, I'm saying what is safest. And that's sort of the viewpoint of the physician, right? Other than wearing your helmet and bright clothing, it's very important that they're protected and these lanes are not close to large, fast moving vehicles. So hope that answers.
Thank you. We appreciate that. Our next questionnaire is one of our local government committee people, longtime member, Vigan Lazarian. Vigan? You're muted, Vigan.
There we go. Good morning, Dr. Kaloostian.
Good morning.
Okay, so I'm sure you've heard discussions at the City Council regarding developing publicly owned parking lots, such as in Montrose or around the Civic Center, or even the south of the Armenian Catholic Church, the big lot there, into mixed-use housing. Do you support such development? And if you support the idea, how will you address parking displacement and protect small businesses?
So I support preserving these lots for various reasons. Many small businesses rely on these convenient parking, and the small business health is one of my top concerns. In fact, I'm donating my entire city council salary to that of small businesses to have direct impact and less bureaucratic delays in any funds that can support them. Also, studies show that over 60% of customers in suburban commercial districts arrive by car. So removing these large amounts of public parking without adequate replacement can harm local retail activity, period. New development should incorporate in the future underground or structured parking. So we should never be at a deficit of parking for our small businesses. So then I would say, I spoke to a lot of the community members around, I live around one of them actually, and frequent Montrose, and spoke to a lot of the businesses and residents who live in the area, and they do not want any development. And so I think it's very important that whatever is suggested is shaped and decided with them with the seat at the table. It has to be, right? Or else we'll see what happened with the bike lanes, right? A big mistake, $1 million mistakes. Not okay. So it always has to be, we can propose these ideas. I wouldn't be in favor of it. We have to ask the community and have them really from the get-go be a part of these decisions. And ultimately, when I asked several of these community members, they said we would love if they are developed for them to have things that we need, like pickleball or a different sort of park, which we are a deficit of. And so, yes, I would not be wanting to develop any of these public parking lots.
Thank you.
Thank you so much. We are going to one of our past presidents and a board member, Carmen Aron, for the last question. Carmen?
Good morning, Dr. Kaloostian. Thank you for being with us today. So my question has to do with rent registry. Do you support or oppose a mandatory rent registry in Glendale? If you support it, what specific data should be collected and how should sensitive information be protected? If you oppose it, what alternative data sources should the city rely upon for rental market analysis?
Great question. So no, I wouldn't make it a requirement. However, I do feel that if Glendale decides to collect rental data, I'm a fan of data, right? Medicine and science, right? And making decisions that are an educated decision instead of what we feel, right, is right. Data is important. So if we do decide, and I would be a fan of collecting some, better than none, right? It would be depersonalized, similar to how I have data on patients, and when you do research, right, with all the proper precautions. It should be limited to non-identifying market level information that helps the city understand housing conditions and affordability trends without compromising tenant or landlord privacy. That should be really thought out well. We should look at other cities and how they've done it and be very, very mindful. For example, the city could collect unit type, number of bedrooms, general rent ranges, building age, vacancy rates, and whether units are rent controlled or market rate, while excluding names, personal financial information, or other very sensitive identifiers. This type of limited, I call, data collection is consistent with best practices used by cities studying rental markets, where aggregated and anonymous, basically housing data is used to analyze supply, affordability, and vacancy trends without exposing private individuals and things like that. By focusing only on the data necessary for policy analysis, Glendale can better understand the rental market while protecting privacy at all costs and avoiding unnecessary administrative burdens on small property owners. So again, very similar to the work I do in medicine. So minimal, only the data that you need, so you can make very have some good estimates, but nothing that's personalized and identifiable for sure.
Thank you very much.
Dr. Kaloostian, thank you so much for your answers to these questions. As I mentioned, you do have 2 minutes for a closing statement if you wish to give us one, please.
Sure. So I guess I just want to, can you hear me okay?
Yes.
Great. I just want to thank you one last time. I want to make sure that, um, everyone understands that I'm a physician. Before running for city council, I will be a physician. After, I haven't rose in the political ladder. I come with some experience from leading county initiatives, including creating the dementia care strategic plan for the entire county. And so I just really feel some of my experience will help on the dais and having a sort of a viewpoint of building strong teams, making sure we run more efficiently, and I think it's time potentially that we have someone who has dealt with emergency preparedness. We have a lot of high density housing that we in our downtown area. We want to make sure evacuations are all like we just probably need someone after these wildfires that is ready to join this team and make sure we continue to be safe as we develop. And I want to make sure that training of mine is also discussed today. And so I did get a master's in public health at UCLA, which was in leadership and policy and involved emergency preparedness. I just want to be available really just in case after seeing the wildfires. And so again, I'm Dr. Carolyn Kaloostian, very small clinical practice, do mostly administrative work, mostly on quality improvement and efficiency at Keck Medicine, a very bureaucratic, difficult organization. I've been able to bring people together with minimal resources and do good in these past 3 to 5 years. And they gave me the permission and said, we do need physicians who are capable like you. And I was very honored and really do hope several of you, what I said resonated and feel that there's a need, and hope I can get your vote, your support for your families, your cousins that are living here, and then of course of your amazing organization. I hope I am one of the top 3 that you can support. But thank you genuinely. And if there's any other questions, feel free to email or call me anytime.
Thank you so much once again on behalf of Glendale Association of REALTORS. Thank you for your presence and joining us for this interview. Have a wonderful day. Thank you.
Let's see. Have a good day. Bye-bye.